Construction healthcare acquired related deaths per year are approximately 5,000 to 7,500 people, but the number is really closer to 15,000 people. This means that when contractors, vendors, service providers, or maintenance people are doing any type of renovation, remediation, demolition, or remodeling, and areas are not properly contained, a significant amount of cross-contamination occurs. Patients are then exposed to air surface-borne pathogens if they're in the nearby occupancy or spaces. If construction is occurring in the areas where patients are located, they can be exposed to these pathogens. Biofilms are becoming increasingly prominent in the healthcare setting as healthcare is becoming very high-tech with more biomedical equipment in use. Biofilms tend to form not only on walls, surfaces, and air handling units, but they also form on medical equipment. If you recall, 53% of all hospitals in the United States are reducing staff. This staff is in departments such as facilities, maintenance, and environmental services. If there is reduction of staff in these critical departments, and there is an increase in biofilms, what do you think is going to happen to the threshold level of superbugs in the environment of care? HAI is a known incident. We know about it. We know about the potential of it. We still did nothing to limit liability, reduce risk, and manage our liability. So we willfully disregarded the potential danger of the situation. And in a jury in front of your peers, if you can't show any type of due diligence, you are going to be found guilty. One question every business owner should ask in the advent of a healthcare-acquired infection, a compromise of a patient's health. Can this healthcare-acquired infection be traced back to renovation, repairs, remodeling, construction, remediation, or maintenance? Education and in-service programs for workers should be different, as every licensed healthcare and design professional is required to have continuing education or continuing learning units. Contractors and specialty contractors should engage in the same process. Infection control course education for new employees and/or those workers new to the industry should have a more in-depth curriculum than those seasoned or who are renewing education. In addition, do you think it might be a good idea to have someone with medical credentials actually advising or assisting on the project? This is extremely important.